Well, good afternoon. It is 12 noon on Friday, July the 9th, and we'd like to welcome you to the 69th edition of the Flint Community Webinar on Coronavirus. This community webinar is brought to you by the Healthy Flint Research Coordinating Center, which is an amazing partnership here in this city of Flint, Genesee County, along with the Flint Center for Health Equity Solutions and the Michigan Prevention Research Center. I'm excited to be your host today, Yvonne Lewis, the co-director of the community core of the Healthy Flint Research Coordinating Center. And we'd like to thank each and every one of you that have joined us today and ask you early on, if you're listening by whatever device you're using. We're live on YouTube, so on Facebook, so please ask others to join us because we've got some really, really important information we'd like to share with you today. For the past 69 weeks, we've had this wonderful array of partners who have joined us to provide information for you. And we started off talking about the coronavirus in March of 2020 because it was a new experience for us having a global pandemic. This is the first time many of us have lived through something like this. But all of these partners have come together at some point in time during this 69 weeks to share important and credible information with you. So we're excited about being able to continue this effort. Today, we are going to be focusing in on this continual reopening of Genesee County. Of course, the whole state is opening, but we want to look at what's happening specifically here in Genesee County. We'll have a medical moment for you, and I know you're excited to see what's coming up in the medical moment. But there's another really important issue that's been looming, and that is on the horizon really quickly. The Eviction Diversion program will be coming to a close, and we want to talk about that. Our hospitals, we want to understand what they're doing in this reopening phase. And of course, there's more to learn about the Flint water settlement hearings. If you have questions, we're going to encourage you today. If you're in the webinar, please go to your Q&A button and put those questions in the queue. If you are listening to us and you want to give us a call, please give us a call at 810-835-2130. Again, that number is 810-835-2130, and we will be really eager to hear and be able to answer your questions. We want to get started quickly today because we've got so much we want to share with you. And again, we're looking to have you be engaged by putting your questions in. So Gary Jones, who is a community affairs representative for Flint in the governor's office, is here to give us the updates from the governor. Gary.
All right, yep, thank you, Yvonne. Yes, the governor recently joined students, educators, and support staff out in Macomb County. This was to sign a bill. This was a huge bill. It appropriated $4.4 billion in federal COVID relief funding to support schools across the state and to help students, teachers, and as well as schools recover from the pandemic. The historic education funding represents the bipartisan work completed in late June to ensure that Michigan's K-12 education system takes advantage of funding to make an unprecedented investment in our schools. The funds will be distributed to districts that serve students with the highest need. They will help meet a wide range of needs arising from the coronavirus pandemic, including reopening schools safely, sustaining their operation, and addressing student emotional, mental health, academic needs resulting from the pandemic. The governor also recently, more than 1 million Michiganders have entered the My Shot to Win sweepstakes, which is a lottery-style raffle that gives vaccinated Michiganders a chance to win more than $5 million in cash and a combined total of nearly $500,000 or $500,000 in scholarships. In an effort to encourage more Michiganders to get vaccinated, the Might Win sweepstakes includes 30 daily drawing prizes worth $50,000 for those who get their first dose during the sweepstakes. Also recently, the governor promoted her proposal to invest $150 million in federal relief dollars from President Biden's American Rescue Plan, critical needs in local park systems. The proposed investment would be administered as a grant program by the Michigan Department of Natural Resources and would support the economies, health, and recovery of communities across the state. Last month, the governor announced a similar proposal to invest $250 million of the American Rescue Plan funding in parks and trails managed by the state of Michigan. And lastly, the governor recently made an announcement regarding a proposal to invest $1.4 billion in federal child care funding as part of the Put Michigan Back to Work plan. The plan helps people go back to work, support their families, while giving them the peace of mind that their children are safe and cared for. Her plan also has in child care professionals and programs. Child care professionals are essential workers, and they are underpaid for their expertise and their service. That's why the governor is proposing premium pay for educators and scholarships to make it easier to earn a degree or certificate. Like many small businesses, child care programs are struggling to keep their doors open. So the government is proposing this funding as a grant program to keep providers open and financially secure. This plan will build on previous investments to expand access to affordable childcare. Just last year, the governor signed a state budget that delivered 26 million to make more working families eligible for low or no cost childcare through a childcare subsidy. The governor is committed to working with the legislature to discuss new bipartisan legislation that will increase access to child care services for hardworking families while providing additional tools to strengthen the child care industry as a whole. And as always, to plug the websites, michigan.gov/COVID-19 and michigan.gov/coronavirus to keep up with everything that's happening.
Thank you. Thank you so much, Gary. I want to just ask our roundtable to come, and I want to engage you in a little bit more conversation, Gary, because you mentioned a couple of times that the governor is working with our legislature, and this is so important and she's proposing these activities, but she needs the support of our legislature. And so one of those things, you mentioned childcare, how important that is. Can you just expand upon that a little bit?
Yeah, so during the pandemic, I think everyone remember at one point in time, like the stay-home orders, things of that nature. There were like these smaller kind of childcare, facilities, and truthfully, childcare is something that has really been underfunded and I would say even underappreciated as an industry for a while. But the pandemic, and COVID-19, made it extremely difficult, for them to really sort of doors open. But also too, as well, the real important thing here is we're talking about putting Michigan back to work. There's a lot of parents that have a really difficult decision to make as far as getting back into the work economy or staying at home, with their kids. And so we want to make sure that if you decide to participate back in the work economy, that their children are going to be cared for, and that also that it's affordable too as well, because anyone that has ever had to pay that bill know that it's a significant expense.
Yeah, and so Gary, when we talk about that, we also look at this other big piece of information that's out there, and that's the eviction program. We talked about that a little bit, and we'll delve into that a little bit more. But when we're talking about the safety and health of our community, we need people to be able to stay in their homes.
Yeah, so you probably remember a few weeks ago, the governor did sign a bill. It did invest $2 billion in federal COVID relief funding. And that was for a part of that, I should say, was actually for this, some for the Supplemental Nutrition Assistance Program that we all know is SNAP. One of it was to help keep a roof over people's heads through the Emergency Rental Assistance Program. It was about $378 million in federal funding for grant awards to be distributed and used to assist renter households at or below 80% of area median income for that Emergency Rental Assistance Program. But I do not think that that was full funding that was received by the state. I believe there's still some dollars left on the table there. So to your point, we would need the legislature to appropriate the rest of those dollars to the folks.
Yeah, so Mary Catherine, I know this is a conversation that's near and dear to your heart with respect to some. So can you talk about what you know about the Michigan eviction program, diversion program?
Yeah, so this is so right now this is kind of the only other option that's that we have, and as Gary said, we really need legislatures to allocate this funding because quite plainly evictions damage public health. This is why the moratorium from the CDC is in place. And so the issue is without that funding, the only protection that we have is from the CDC, and it ends on July 31st. And just from a public health standpoint, we know this is so concerning because eviction rates will rise as a consequence of this policy's expiration. And we're going to have more situations where people are in crowded conditions, which is certainly not ideal during a pandemic.
So let's reach out to our health professionals. We've got Dr. Wolford, Dr. Reynolds, and I see Dr. EJ also here. How is this, from a public health physician perspective, what do you want to encourage us to understand about how this will impact our public health? Doc, I see you. Yeah, there you go, Dr. Reynolds.
Well, I'd start off by saying if you live in a crowded household and you have so many people using one bathroom or two bathrooms, that increases the chance of spreading infection, especially if people, for COVID-19, if people have not been vaccinated or they are not masking. So this has a critical impact. And so then it goes from the overcrowded home to the schools, to the job, to the rest of the community. So this is, well, as I said earlier, various places were shutting off water during the hepatitis A outbreak when personal hygiene was most important. So this is not the first time this error, and error is probably being too generous, is made. We must protect the public health. That is the basic responsibility of government.
Thank you so much, Dr. Randall. Dr. EJ.
Yeah, I guess I would just second that. I think it highlights the idea that it's incumbent upon us to have a public health lens when we're providing care to people in the community, right? If we're not thinking about the idea that patients might be experiencing eviction, or we have populations experiencing homelessness, or people who don't have access to resources, then we can't be thoughtful about solutions. And like Dr. Reynolds said, then we run into populations who are being asked to quarantine but don't have the ability to do so. And so I think it makes it our responsibility to make sure we're being thoughtful when we ask questions of our patients, and understands that not everything is non-compliant. Some of it is just no resource. And it's important for us to work with sort of our public health resources to see what we can do to make sure those resources are accessible.
Thank you, Dr. EJ. And you raise an excellent point that, and we talk about this often, one of the reasons that we do the webinar is to provide people with information that they can make informed decisions. So if you're understanding, excuse me, if you're in this situation and you have to go to a healthcare professional, be open and tell them what's going on and see what kind of advocacy support you can get from that institution, while we're waiting on our legislators to do what we need them to do to help us out as well. So I don't want to miss anybody in the roundtable. I see Tarnisa, you're going to be coming up in a minute. I saw you nodding your head as a new representative for us on here. So you can hold on to some thoughts you're making for this question and bring it up when we talk to you later, because that's one of the critical roles that you'll be serving in our community to help with this advocacy. Gary, did I see your hand for one more comment on this? Oh,
no,
no,
you just saw my pen. That's all. I do take notes. I update and I learn from this webinar. So thank you, everyone.
Okay, so let me just appreciate our roundtable. Thank you for those insights, because I think coming up to the end of the month, I think it's July 30th is when we need some action on this. So let's keep that in mind. Let's remember to ask questions. And if you know someone that needs some support, give them Gary's information. Give them that website so they can follow up with him. So thank you, Roundtable, for that. And it really leads us into the next level of our conversation when we're talking about individuals who may be homeless or may be suffering some challenges right here in the midst of COVID. We were doing pretty good. Dr. Deborah, you were so excited to tell us a couple of weeks ago that rates were down, cases were down. Kind of tell us what's happening now.
Yeah, so this is a great conversation and a great segue. You know, I told you the public health person in me wanted everybody to continue to mask, even if you've been vaccinated, despite the changes in laws. And I'm still an advocate for that when people are in public. And the reason that I advocate for that is because not everybody is vaccine eligible. Children are not vaccine eligible. There are still people with chronic health conditions or who are immunocompromised. They have some kind of condition that makes their immune system weaker. And so I felt like it is still for the public good for us to make sure that we're not just protecting ourselves, but the most vulnerable among us. I asked everybody to take the numbers with a grain of salt. You know, we celebrated 10 weeks of successive decline following that big surge that we saw in Michigan. And for the first week, the cases are up a bit. We decided to give people the actual numbers. So last week in Genesee County, we had 21 COVID cases. We had 13, and this week we had 21. Last week we had 2, and this week we have 8. We have to figure out what that means, and we have to monitor this over time. What I'm really hoping is happening is that they'll be genotyping the strands that we see in our community. A lot of people have asked about the Delta variant and what that means. The early data show us that vaccination seems to be a strong protective factor, even from the Delta variants. So I still encourage everybody. We still have to continue the work and the push to get people vaccinated. If you look, you can see 20% of our 12 to 15-year-old population have received their first dose, and just over 15% are fully vaccinated. More troubling is that in our total adult eligible population of 16 and over, we just barely hit over the 50% mark of people who are fully vaccinated. If we want to have our best wall of protection, I'm an epidemiologist by training. I've got lots of colleagues who've done the statistical modeling to see where we will likely be with the introduction of this Delta variant, which is wreaking havoc in other parts of the world. The best protection that we have at this point is for people to stay the course, to get vaccinated, all of those who can and are eligible. You now have vaccines freely available to everybody. You don't have to make an appointment, you know, waiting on the wait list and all of that stuff is gone. So I just encourage everybody here, be a trusted, credible messenger in your community. We will be monitoring these trends, trying to make sure that we don't have a surge sneak up on us. But in fact, the numbers have started to, you know, slightly move up. And just to put in perspective, still dramatically lower than it was at the worst point in the pandemic. So we're talking about the difference between 2 cases and 8 cases, right? So we look at that in percentage increase, it's a 4-fold increase or a 400% increase, but we're talking about the difference between 2 and 8. And as I was talking with Mary Catherine about this, who really designed this health equity brief to make sure that people could get good information that they could digest, that could be attributable to one household. We just don't know. We have to keep doing the work and looking. So in the meantime, everybody practice good prevention. This is what it looks like. We've shown you the last 5 weeks, but really we had 10 weeks of successive decline, and we can see we've got a little bit of an uptick this week. We'll keep monitoring and let people know in the weeks to come what that means and what they need to do to protect themselves.
Dr. Deborah, can I just ask you one quick thing? You mentioned the term genotype. Can you describe what that means? Because when we hear the Delta variant, how do we know that? And just clarify that a little bit.
Yeah, so you know, think back to some of these great Dr. Wolford you know, representations of what the virus looks like. Always, I tell people, think about the variants as this. It's the same basic virus, but imagine if, because you know, I always change my hair, right? Never the same hair, you know, for more than a couple of weeks, right? And so there are some people who don't really know me, and they'll say, oh, I barely recognize you, but they still recognize me. I change my hair, that's it. You might change your earrings. You might lose a little bit of weight. The basic sort of makeup of the virus remains unchanged, but these little changes do happen on the viral molecule. But those little changes are the virus's way of being more crafty at trying to outsmart us and spread easier and also potentially make people sicker. Viruses have only one goal, and that's to survive. They're just looking for a host. They cannot replicate out on their own. They need the machinery of the human body to be able to replicate. So these variants are the equivalent of the virus with a new hairdo, you know, different earrings, different makeup, all of that. And when I say genotype, I mean, we should be looking at, of the cases that we have, which strain of the virus are they infected with? And the reason that that's important is because as these variants emerge, and again, remember the variants are being, you know, coming out typically better and stronger, more transmissible, and seem to cause more harm and more death. So the goal would be to understand which strain of the coronavirus we have in our community. So we can hopefully hear from Dr. Hackard or somebody from the health department in an upcoming webinar and find out what resources we need to generate to be able to understand which strains we have in our community.
Thank you, Dr. Deborah. Just want to make sure that we get some of those terms clarified, because we're going to be hearing these on the news more often. And certainly one of the things we want to do is have an informed Flint community, Flint, Genesee County community. So Mary Catherine is going to give us some more information about what we can do as it relates to these policies.
Yeah, so if you have any questions about anything Docs went through, just shoot me an email, crawf457@msu.edu. So I want to take it back a minute and just kind of bounce off what Gary had mentioned about the importance of these investments into childcare and how important this is to get people back to work. And so I want to talk about the Employee Fair Scheduling Act, because this bill will help address some barriers to employment that people face by actually requiring certain employers of the food and retail industries and other hospitality industries to provide a written work schedule 2 weeks in advance, which really will help provide important stability so that workers can make those childcare arrangements or transportation arrangements so that they can then get to work. And it would also prohibit employers from any kind of retaliation if individuals were unable to pick up shifts beyond those set schedules. So really, that's going to be a piece of legislation I'll be keeping a close eye on. One of the other House bills that was put forth was to criminalize or officially make it a crime to display a noose on any private or public properties. And this is actually something that would be punishable with both imprisonment and some hefty fines. And I just think this is really important amid a call of a year where we are calling for racial equity and healing. The last thing, and I know we've talked about this, but it's because it is so important, is that we need our legislators to move that money into the hands of renters and tenants to keep people in their houses and not undermine the public health effort that we have in place.
Thank you so much, Mary Catherine. Appreciate those insights that you've given us and give us something to think about so that when we're asking questions, we are asking questions with some good information in mind. So Dr. Deborah has also mentioned that now we're right here in Genesee County, we don't have to wait in line anymore to get an appointment. It's available for us. Vaccines are available for us. Testing's available for us. Sherelle, there's some exciting things that are happening in our community around this. So will you give us an update from the health department as to where vaccines and testings are available?
Good afternoon. I was going to say morning. So yes, we still have vaccine availability in Genesee County. Today, we are at McDonald's on Miller Road. So if you have not gotten vaccine, please get there. We'll be there from 3 to 6 p.m. today doing vaccines. Get some freebies, some food, some McDonald's gear. Come out, get your vaccine today. Dr. Furholden, she gave a lot of updates about where we are in Genesee County. So we do have 43% of our population fully vaccinated, which is awesome. And I noticed when I was putting my slides together that months ago, we were doing almost 1,200 a day. And from last week until now, we've done about 1,200 vaccines. So that's in a week's time span versus daily. So I just want to remind everybody to continue to get your vaccine. We're at 43. Let's get to 50 by next week.
Okay.
Yes. Next slide. As of today, we did pull the positivity rate. As Dr. Verhoeven mentioned, we have seen an increase in cases. It's small, but it's still there. So our positivity rate actually went from 0.8% to 1.7% as of this morning. And in Genesee County right now, we are seeing an influx in the P1 variant, which is also more transmissible, just like the Delta variant. So with that being the fact, and the number of unvaccinated persons that are still out there, it leaves room for more people to be at risk of getting the COVID-19 infection. So we're still encouraging you to get a vaccine and stay protected. And here are our upcoming clinics and times for next week. So like I mentioned, today we're at McDonald's. Tomorrow we're actually going to be at McDonald's too on Saturday from 10 to 2 p.m. So if you miss us today, come on out tomorrow. And next Tuesday we'll be at Our Lady of Guadalupe, as well as the Clio Area Senior Center. We'll be giving out Moderna and Pfizer at Our Lady of Guadalupe, and then Pfizer and J&J at the Clio Senior Center. And then Wednesday the 14th, we'll have our clinic that's always there on Wednesday, Central Church of the Nazarene, from 8 to 1, and we'll be doing first and second dose Pfizer, as well as Johnson & Johnson. And we'll also be out at the Bicentennial Park in Grand Blanc. We'll be on site from 11 to 5 p.m., and we're offering Pfizer and Johnson & Johnson as well. So if you have children that's 12 and older, we encourage you to bring them to one of those sites. And then you can always catch us on Thursday at Shiloh Missionary Baptist Church. We'll be on site from 1 p.m. to 6:30 p.m. doing the Pfizer and Moderna vaccines next week. So the availability is widespread. Come to any clinic, walk in. You don't need to make an appointment. Just come get your vaccine. We want to protect our community. And if you fear that you might have come in contact, knowing that these new variants are more easily spread, please go get tested. On the screen, I have some of the standing clinics within Genesee County that you can get a free test. And those clinics remain at Bethel United Methodist Church, Macedonia Baptist Church, as well as Word of Life Church. You can also visit your local Rite Aid or Walgreens or the Hamilton Community Health Network or Genesee Community Health Center. And still, if you are homebound or you know someone who is, please don't hesitate to contact the health department. You can call us at 810-344-4800 for help getting registered for us to come visit your home. We also have a website that you can go to, which is www.gchd.us/vaccine scheduler/. We look forward to serving you, and we look forward to getting our vaccination numbers up.
Thank you so much, Sherelle. And I do want to point out the importance of knowing where these vaccine sites are. And I appreciate you putting on there which vaccines are available, because I received a call actually this week, someone who has to go to the hospital and they needed to have the vaccine before they could go.
Oh, wow.
And they needed it in short order. So they needed the J&J because they couldn't wait 2 weeks before getting the Pfizer or the Moderna. So it was helpful to be able to go back and say, this is where you can get a J&J vaccine, or if you want the Moderna or Pfizer, here's where you can get it. So much appreciation to you for adding that information to the site.
No problem. And then we also have our clinic at the Burton Health Department location where you can come in and get a vaccine there too. So keep all those places in mind, and we're available. I wanted to mention that Curative, we will no longer be working with them starting next week. So that won't be available to the community. They were at Diplomat on Saginaw Street. So we're back to just the clinics that the health department is offering or the local pharmacies.
Thank you so much, Sherelle, for that information. So we want to move now quickly as we think about our community opening up and all of the wonderful things that are going on, or I said the information that we're getting with respect to the vaccines. But we know that our community still has questions about what's going on with regard to the water and the pipe fixing. So we have with us Lottie Ferguson, who's the Chief Resiliency Officer for the City of Flint, out of the Mayor's office, who's going to give us an update on the pipe replacement program. Lottie.
Good afternoon. Before I
Good
do
afternoon.
that, I would like to make sure that everyone knows that beginning Monday, July 12th, City Hall will continue expanding its hours as part of a phased reopening plan. So City Hall will once again be open from 9 a.m. to 5 p.m., again beginning Monday, July 12th. Specifically the Assessor's Office, Building and Safety in the South Building, the Front Desk, Customer Service, the Mayor's Office, and the Office of Public Health. Additionally, the Ombudsperson's office will be open from 9 a.m. to 2 p.m. Monday through Thursdays, and Fridays by appointment. Wanted to make sure that everybody knows that the deadline for a service line replacement is July 23rd. As the slide says, go to www.cityofflint.com/get-the-lead-out for the consent form, or you can give us a call at 810-410-1132, or email get-the-lead-out@cityofflint.com. And as stated here, if you completed a consent form before March 15th and your line has not been replaced yet, please submit another consent form. We want to also remind people to make sure that we would love it if you are able to work with scheduling for service line replacement. You do need to have someone present in the home when that's done. Someone over 18 is present in the home. As of June 18th, we've replaced 10,041 lines. We've excavated a total of 27,092 lines. The other 17,000 lines and some change had safe copper lines, and so they did not need replacement. Also want to mention that the waste pickup contract was extended for 90 days, and so due to a staffing shortage, trash will be picked up every week, but recycling and yard waste will be every other week. The first week of the month will be yard waste, and I believe the second week is recycling. If you have any more questions about any of those, feel free to drop those in the chat. I'm happy to respond.
So can you give us that again, every other week for recycling?
Yes, every other week for recycling and yard waste. Every week trash will be picked up, and then every other week will be either recycling or yard waste.
Thank you so much. I needed that information today. I appreciate it. Thank you, Lottie, for sharing with us. And we look forward to continual updates out of the Mayor's office. This is very helpful. We also have with us today Dr. Larry Reynolds, Dr. Lawrence Reynolds, Dr. Lawrence Reynolds. Retired physician and just full of a wealth of information. So I've got some questions for you, Dr. Reynolds, but I'm going to let you just start off with sharing, and we'll get to some questions.
Let me say I'm speaking as a Flint resident, and I'm speaking as a plaintiff or someone who filed a complaint in the civil settlement over the Flint water crisis. And various issues have come up. And one of the main issues is that people are signing up for what someone is calling a bone scan using industrial equipment that was made to be used on soil, metal, rocks, painted walls, but not on humans. And if you will look, you will even see veterinarians don't use it on people's pets. So the question is, why is this equipment being used on the residents of Flint and the other claimants? This equipment, I repeat, is not approved for use on humans. The user's manual says do not point it at humans. The manufacturer, their attorney, as well as their vice president, Thermo Fisher, has written communications to the attorneys involved telling them do not use it on humans, and yet they persist. So this is heaping insult on top of the injury that we as the Flint community have already sustained due to being poisoned with lead. What is the value of this study? They say that it will tell you if you have lead in your bone. And they say that this will be evident of the fact that the water did this. That is not correct. It does not tell you when you got that lead in your bone. It does not tell you the source of that lead. And then the question is, having known this, what will it get you? Well, according to the attorneys who set up the office that did the testing, it will tell you how much money you're entitled to. And yes, you will get more money if you have a positive test. But they don't tell you what the bottom line is, the sensitivity. Will it pick up everybody if it is the correct test and it's not? If it was the correct equipment and it's not? But it will tell you if you have lead. But it may miss some, it may overread some. And then the question is, were you informed of this before you submitted yourself or your family member to this study? I call it rogue research, because when you do research, there's a body called an institutional review board, usually hooked up with a university. This process is not hooked up with university, and you must meet certain qualifications. You must ensure safety to the degree that you can, and you must assure people that it has no, they're not using it for any medical treatment, because it's not a part of any accepted medical treatment unless you are acutely ill. In other words, dying or disabled due to lead poisoning, like you work in an industry that works with lead. So people are being misinformed. Then when you get the result of this study, there's no norm, there's no range. They don't tell you if you're highly exposed, minimally exposed, and they have no intention of guiding you through the treatment process should you have a problem. So it's just one layer of disregard for the health and safety of whoever submits to this test. It also is not related to any treatment. It's so egregious, I can't understand why the judge even approved this and why the other attorneys are even going along with this. There was what was called, and here I go crossing into law, and remember, I'm as good on law as a lawyer is in a surgical suite, but I'll say it this way. The writ of mandamus is asking a higher court to tell the judge, get right. They denied that writ. They said, well, we were talking about things that could happen, might happen, and until it does happen, we have no grounds for appeal. But what I've learned about the law is once you put it in writing and you get it on the record, it does open the door for further action in the future. So this is a long way off, and I'll also say this is not the only lawsuit. There are several civil lawsuits, and I won't even talk about the criminal investigations.
I'm on mute. Dr. Reynolds, you said so much, and one of the reasons why we're having this conversation, and a question was in the chat was, so what do we tell families who have already had this done? And one of the reasons we're having you talk about it is to alert people who haven't. But the question is, if they've already had it done, what do they do? Do you have any information for us there?
Oh yes, number one, ask for a printed copy of your results. And you will see on the earlier result forms, they wrote Harvard University School of Public Health and New York University School of Medicine. They had their logo on the top, you know, their design. New York University said, take our name off of this. When we called Harvard, Harvard sent a 6-page document which said, we basically have no record of any research applied for by Dr. Speck in order to do this study. So what I submit to you, it's real sketchy, if not real dishonest and unethical. Okay, so how can you interpret the results? These are the things that you should ask the attorney. And I'm sure he or she will tell you, you need to go talk to your doctor. Ask them, did you know that this equipment was not approved for use on humans? Why did you send me there? And what are you going to do about that to help correct the situation? So those are the basic questions. And so, you know, people have heard the mayor say in the past, watch out, people are trying to pick your pockets. This is one of many suits. This is not the end. And what he's telling you is you must ask questions. And I hope that I've given you some information that you must ask questions about, because these are the same questions I had to ask for myself and my family as a plaintiff or someone who has had a complaint.
So Dr. Reynolds, we appreciate that, because without that information, we wouldn't even know. I mean, if you hadn't raised this in your complaint, many of us wouldn't even have known this was going on and it was being done in an inappropriate way. One of the other things that is of a concern and a question is, next week, we've heard about some hearings that are going to happen, and understanding you're one of the plaintiffs and you'll be testifying. And last week, one of the questions in the queue is, what can we do as citizens? Is there something we can do to help? What should we be looking for? And how can we learn more about the process?
Well, you're asking the wrong person. I'm not an attorney, but I will tell you what I know. At this point today, I know that July 12th, I'm supposed to be in court to testify, and I assume it's in person. So I will be there in person. I know that the next day, people who don't have an attorney, they call them unrepresented, but have objections, will be heard from. And so this is the communication I got at the end of June. I don't know if it's changed. And when I get an update, I'll let you know. But I have to know by Monday. But Monday I'll be in Ann Arbor. These hearings will go on through the 15th. Then what will happen? Well, that's a good question. And that once again, that's one for an attorney. But the most important thing is, if you have filed an objection through an attorney or on your own, you must make sure it's in writing, or you must be on the record, because the only thing that counts in the court is what's on record. And sometimes it looks like you lost and you've not prevailed, but it provides the foundation for the next legal step. And this is a struggle. This is not going to be resolved overnight. And if it does, I'll have some significant questions about the legal process.
So thank you, Dr. Reynolds. And we know we're 7 years now into what we're calling, and we're known around the world now as the Flint water crisis. It isn't over, as you said. There's more to come, but one of the most important things for all of us as residents to do is to ask questions, and as much as possible, ask them in an informed way. Again, I want to appreciate particularly our social workers, our community health workers, and family members who take this information from the webinar and share it further in the community among family and friends. This is one way that we can get the word out to make sure that our community is informed. So thank you, Dr. Reynolds, and we'll look forward to hearing what happens after the hearing.
All right. And keep the faith.
We shall. And one of the ways we do that is to hear from one of our incredible partners and physicians with all these wonderful and amazing examples, Dr. Susan Wolford. And Dr. Wolford, I don't even know how to set you up today, except for to say you're going to help us understand why and give us really good explanations why the vaccines are so important. We did have a question in the queue, and maybe you're going to address it, is with all of the variants and things that are going on, how do we know what's happening, and how do we know which ones are in our communities, and how do we protect ourselves? Dr. Wolford.
Thank you so much, Siobhan. That was a two-part question. How do we know what's in our community, and how do we protect ourselves? So how do we know what's in our community? That sort of goes back to Dr. Verholden's point about getting the testing done and knowing which variants are circulating. And so that's something that hopefully we can have Dr. Hackett tell us some more about when she's with us in one of the upcoming weeks. But certainly we can know that if people are getting frequent testing, then we can find out what's circulating in our community. And then how can we protect ourselves? So that gets to the heart of what I'd like to talk about today. A lot of people, when it came to getting the vaccine, have been saying, you know, I want to wait and see. We need more evidence. They need to feel comfortable that this is what they should get. And I think that what has been happening over the last several months is that we've all been part of, as you've often said, a global experiment. We can't not be in this experiment because we are on the planet and therefore we are exposed to COVID. And we have had lots of data over that time that should really make us feel a little bit more comfortable about getting the vaccine. And so I want to share some data today that I'm hoping that, I know that I'm speaking to the choir, but I'm hoping that we will then share this with all those around us who might be somewhat hesitant about getting the vaccine. So if we think about, I'm sorry, I have to jump right to it, going to look at death, because that's what we want to avoid, right? There's a lot else we want to avoid, but at the end of the day, nobody wants to die from COVID. So if we think about where we were in January of this year, we were in the US at over 3,000 deaths per day from COVID. And by June, we were down to more like just over 300 deaths per day from COVID. Well, what was the cause of this dramatic drop? It's important to notice that over that time, the number of us that were vaccinated increased dramatically. And so because of those vaccines, we know it's in large part because of the vaccines, because the greatest drops are being seen in the areas where vaccines have been received at higher rates. And the areas where they are not getting vaccines at the same rate, their rates of deaths are staying high. So if anybody needed evidence that vaccines were important and were helpful and something you should get, I think this really highlights that. And you might then say, well, it's down to just over 300 deaths per day. Do I really need a vaccine now? Is 300 deaths per day such a bad thing? Well, I would like to say it is, and let us compare it to other things. If we look at deaths in June from flu and pneumonia, that was 115 deaths per day. If we look at diabetes, that's over 200, almost 300 deaths per day. So when we put COVID in light of those other illnesses, we see that it is still very deadly and something that we should avoid, because of course, any death is a dreadful occurrence, right? So there's something else I would like to say about this. If we think about those 342 deaths per day, we have to think about the fact that there are two types of people in the US right now. And when we look at outcomes from studies, we often say, okay, is it that men get it more than women? And that's true, when men do die more often than women from COVID. And then is it down to race? Is it being white versus not white, or being a person of color? That does increase our risk of dying from COVID. But really, it comes down to two types of people when we look at deaths from COVID. If we look at the 342 deaths, all those people that you're seeing there, the vast majority, all 342 that I counted out and put on this page, are unvaccinated, except for, on average, 5 people who may have been vaccinated and died. Look at the risk, look at the difference. And there's some states where they're saying 100% of the people who are dying from COVID are those blue people, the ones who are not vaccinated. If that doesn't convince somebody to get vaccinated, one wonders what will. Because the risk of dying if you have been vaccinated is infinitely less than if you haven't. And so I'd like to just suggest, I guess I'll stop sharing my screen right now, that we are very much like we're living in these test tubes. We are in an experiment. There is nothing we can do. We can't jump out of the test tube. We have to be in it. And if we are running around without a vaccine, we're much like this Alka-Seltzer that just immediately dissolves. We are at the whim of COVID. But if we protect ourselves, like I've protected this Alka-Seltzer by covering it with a film, let's consider that film as being a film of vaccine, in this case it's nail polish. Notice it is not at the whim of COVID because it is protected. Anybody you know who is not vaccinated, let them know that these data show, we have the evidence now to show that you will be incredibly protected by taking the vaccine versus not.
Well, thank you, Dr. Wolford. You did it again. Good example of sharing the value of the vaccine. And so we still have a lot of people who are in that place of asking questions as to why. We have parents who are concerned because they're making this decision for their children. So we appreciate you giving us. I just want to make sure if you've got one last tidbit you want to share with us, particularly to parents who are in that decision-making place.
So this is the right time to ask your provider. Providers have more information now than they had when this all started. Speak with your provider, get your questions answered so that you can protect your children, those who are old enough to be vaccinated. And for everybody else, we have to continue with everything else. We have to wear our masks, wash our hands, social distance to protect those who cannot be protected by the vaccine at this point.
Thank you so much, Dr. Wolford. Appreciate your insights for today. And I'm excited to say that coming behind you in this next segment of our webinar today is Ms. Tarnisa Martin from Hurley Medical Center. And she is in an absolutely wonderful position to be an extension of helping in our community. So welcome, Tarnisa.
Hi, everybody. You know, everybody has been phenomenal. All I can say is wow. My passion to be in the community, to help educate, have been like tripled from listening to everybody's presentation. Just so you know, Hurley Medical Center is here for you. My name in the community is Nurse T. Hurley created this position to go into the community and connect with the community one-on-one and be visible. As you can see, I do have some experience. I've been an RN for 19 years at Hurley Medical Center. The last 12 years of my career was managing a med-surg unit, a very complex, diverse unit. I have 18 years of being in the community, serving on various committees, hosting events, doing a lot of things. 6 years experience of being in education. I was a clinical instructor for both Mott and U of M. Next slide. So this position was created to ensure Hurley is reaching underserved population that may be fearful of accessing healthcare due to mistrust in the healthcare system. Somebody mentioned that not everything is about being non-compliant, and that is so true because so many times being a nurse manager on a unit, a lot of patients missed out on opportunities to receive service because they was frustrated or they had questions that they were afraid to ask or they couldn't articulate their concerns very well. So one thing that we really want to do is make sure that we build trust, and you build trust by being visible and connecting to the community. There's a lot of health-related knowledge deficits. The community that we serve, they always don't receive information or they don't have accurate information or they have a perception of the information, or they have fear. A lot of it is fear, a lot of it is suspicion. So this position was created to help reduce the myths and the barriers. Unaware of available resources. Hurley Medical Center have a ton of resources for the underserved population, for the minority population. But the question is, how do we get these resources to the community? And how do we get the community to trust that these resources are available? A huge issue is racial stereotyping. Patients coming into the medical center not feeling that they're receiving the same service, or just the communication, or being non-compliant, or that we're automatically thinking that they're going to be non-compliant. So this position was created to help resolve some of those issues so that we can improve access to care. You can go to the next slide. Patient resource and community advocate serves as a community liaison for identified health concerns. Our top 5 concerns that we've identified in the community is heart failure, stroke, diabetes, COPD, and end-stage renal disease. And these are the surrounding zip codes, you know, from 48503 all the way up to 48507. And a lot of it is because of health literacy, not knowing about available resources, the housing, the transportations, everything that can impact their decision for care. I know one of the questions Ms. Yvonne had earlier was about this partners with community-based resources that can be assistive for Hurley to meet goals of enhancing access to care and improve health compliance. Just like this webinar, it's sharing information and promoting why it's important to get the vaccinations. It's giving dates and locations. It's giving us an opportunity to connect and also come on site so that we can partner together for the good of the community. Being able to participate in community outreach and educational events. A lot of times when I'm out there, I look for platforms to where I can go and connect and just be visible and share healthcare information. I can go to the next slide. So updates on COVID. As everybody has said, it is very important that we get our COVID vaccination. Hurley is still caring for patients safely. We're wearing our appropriate PPE, and we're following the CDC guidelines. All the visitors and patients are still asked to wear a mask when they enter into the medical center. The only time patients in the hospitals are required to wear a mask if it's contraindicated, like if they can't breathe. But for the most part, everybody is staying safe. Even though our numbers have decreased, I can say yesterday we only had 5 COVID cases. And that's a huge celebration, you know, for the community to hear that we are decreasing. But just because we're decreasing in COVID numbers, we're still practicing safe, and we're still have restricted visitation policy. That's a huge concern for the community. And I understand as far as when we were caring for patients and the community was not able to be visible. So we tried to do everything that we could to communicate to the family and keep them updated. So right now we currently have visiting hours from 9 to 1, 4 to 8, and we can have 2 adults that's designated, but you can only be present 1 at a time. For pediatric, we non-COVID and COVID patients is 2 adults designated visitors. For COVID patients, right now we still have 0 visitors. So that's a concern, and I know, but we have to where we have systems in place to where you can FaceTime and have allotted times to follow up with the providers and the nurses so that you can share information. Even in this role, I'm an asset. So if anybody, you know, needs to reach out to me, if they have concerns about their family members being in the hospital, they can reach out to me and I can follow up. You know, I can even go up on the unit and talk to them. So that's basically it.
We thank you. We thank you, Nurse. Yep. So we thank you, Nurse T, for joining our team. You'll be here to answer questions in the future for us. And we know now that we have this wonderful wonderful asset right here at Hurley Medical Center in you being that advocate. So thank you for joining
Now,
us.
may
And
I
we
ask
want to
one
thank all of our,
question?
we want to thank all of our listeners because we're out of time and we'll get to come back next week. We're going to come back next week with more information because we want to make sure that we acknowledge that our continuing education units are available for our community health workers and our social workers so that they can get their credits and continue to share this information within the community. We want you to continue to join us every week. You can like us on Facebook, you can join our YouTube channel, and make sure, again, that you're getting this credible information that's available to us in our community. Give us a call at 810-835-2130 if you need more information. And we look forward to you joining us next week right here on the Flint Community Webinar on coronavirus. Be sure you put those questions in the queue and we'll be happy to answer them for you. We'll be back here next week with more great information for you. Thank you for joining us today.